Okay, hello, Donna Zubrod. It's so good to talk to you from the other side of the world. This is Donna. She's my friend. She's my colleague. You'll notice that I'm always interviewing my friends, but that's why being Arvigo therapist is such a great place to be, because I have friends all around the world. So Donna is an Arvigo therapist. She's a teacher. She teaches the whole range of classes, and we've had a whole lot of fun teaching pregnancy classes together.
Yes, we have. Yes, we have.
She's also a birth doula, and she's a fertility awareness teacher, and I'm hoping we're going to dive into a little bit of that in this conversation. In other news, she is a rather fabulous belly dancer. Kind of my favorite thing is that once upon a time she was an astrophysicist.
Yes,
that is right, isn't it? I did say it right. It's like, how can you be such a nerd and be so gorgeous at the same time? So Donna, before I let you get going, I just want to read a little bit about this card. So I just pulled a card for us, and it is Witch Hazel, and it comes from this lovely collection, the Her Crafters Tarot. It's very apt because we're recording this in the midst of a pandemic, under house arrest, all of us. But for Witch Hazel, when we pull this card, a busy life is an abundant life. Your many skills are called to task at once. Witch Hazel is valued for providing multiple functions: food and refuge for birds, flexible branches for baskets, and bark for medicine. Flowering in late winter, Witch Hazel blends the edges of winter and spring, grief and joy, depth and lightness. The ability to hold the tension of opposing interests brings prosperity. Your stability may feel at risk, but as the flowers promise, relief is not far from you. When the world shifts around you, find solid ground in the present moment. So
how apropos. I mean, I really appreciated hearing that today. That really resonated with me. That's because where we all are.
We are all there, and you know, the ground is really shifting. And for me, one of the sadnesses that I'm really looking at is, and I know it's the same in America, looking at women who are pregnant right now, and what are their birthing situations going to be? I think
I have several birth clients right now, and the anxiety levels are so high, and all I can think of is, oh, poor baby within. Connect with your baby within. Tell the baby everything's going to be okay.
Yeah.
And it's not clear how I'm going to be able to support them other than just being someone they can talk to ahead of time.
Yeah, we have quite a lot of doulas have got together in the UK and are providing telephone support and video support. And then the other thing for me is looking at so many of the women that you and I both work with on fertility journeys. Suddenly that's got hung up in the midst of treatment.
Right, and with all the unknowns, is right now a good time to try to conceive?
Yeah, exactly that. So
we just don't know. So there's a lot of fear and anxiety and uncertainty around that as well.
And we know that none of that is great for pregnancy or for women who are trying to conceive. But the self-care massage that we teach our clients is a really beautiful way to make a connection with their babies, and also to keep your fertility buoyant, and to keep your cycle working the best it can be for you. So you're a fertility awareness teacher, and you also did a study as part of your work with the Arvigo Therapy, and you did a study looking at how our work supports fertility. Just tell me a little bit about that and some of the challenges and what you learned from it.
Sure. So, and feel free to interrupt me with questions as I go through if you want me to clarify anything, Hilary.
Thank you.
Many times our clients will say to us, where's the proof? How is this going to work? How many sessions is it going to take? You know, does Arvigo therapy or any kind of abdominal pelvic massage, does it reduce the time to conception in some way? And I've had them, where I teach fertility awareness is actually at an OBGYN clinic, and they were very interested. They wanted to know the numbers, and they wanted to work with me to put together some research studies on this in particular, and doing a randomized control study, and, you know, trying to do the attempt to do more gold standard type of research study. And we did apply for a grant to the Massage Therapy Research Foundation, not once, but twice, 2 years in a row. And what came back was, I mean, you think if you're going to get a grant and they're trying to promote the benefits of massage therapy, that they're going to want the research results to be definitive in some way and not just to come up with a whole bunch more questions. And I think when you're looking at the area of fertility or actually conception, there are so many things, so many variables that play a role in conception. The health of each of the partners, the emotional, not just physical health, but the emotional, mental, and spiritual health as well. So many variables. I've seen many times, we've seen clients who you wouldn't think that they would conceive based on their particular health situation, and you'd see other clients who seem really, really healthy, and you just don't know why.
That's my favorite, or the worst one, unexplained infertility.
Right.
When there is no good reason at all,
right,
that pregnancy just isn't happening.
And we don't know where things are breaking down. And Arvigo therapy is not just a physical therapy. It's why I love it so much. It's integrative on so many levels, and it offers healing, not just physically, but emotionally, spiritually, and mentally as well. So I felt that the reason that the research study wasn't approved at that time for a research grant was because there would just be too many uncertainties, and there are just too many variables of pregnancy. But couldn't Arvigo therapy, it's changed the discussion, couldn't Arvigo, if we could show in some way that Arvigo therapy enhanced some of the biomarkers, by biomarkers I mean signs that we see in our body of enhanced fertility as we go through our menstrual cycle. So for example, how does cervical mucus, we know there's so many research studies, cervical mucus is so important to help nourish and transport sperm. Is that okay? Is there sufficient? Is it for long enough periods of time? And then the luteal phase in our menstrual cycle, which is when we, after we do ovulate, the time from that until we menstruate again needs to be sufficient in time, and also enough progesterone to be able to help the fertilized embryo implant, right? So I started off this project looking at, I wanted to change the discussion, and thereby if we could show some improvements in this, because anecdotally I was hearing this from my clients, and I'm sure you've heard it too. Man, this Arvigo therapy, I'm feeling really juicy there, right? Mm-hmm. Okay. And oh, my cycle's changed, you know, it's longer or something. So, and that could be not necessarily, because that also depends on when they're actually ovulating. It could be a sign. Some of them that were tracking the cycles were telling me that their luteal phases were lengthening. And so I figured that if we could show improvements in these parameters, then those are a couple of variables that are key factors in a successful conception, and thereby associating something that you can do like Arvigo therapy, thereby I'd say that it could potentially reduce the time to conception. So that was the idea behind the study.
Okay, so how many people did you get to work with in this study then?
Okay, so there were 10 people. It was the next 10 clients, the next 10 clients that met a certain set of criteria that I could work with. I needed to know that they weren't taking any kind of hormonal medications, weren't taking any kind of allergy medications, were not going to be trying to conceive during this time, etc. You know, on hindsight, I could, because our cycles change by age, I might have broken the group up into different age groups. Mm-hmm. So started with that, and they would come and see me. The intent of this also, Hilary, was to be a pilot study. This was not going to be a full-blown, right? The idea is that it would be a pilot study and showing some preliminary results to get sufficient interest to do a more in-depth study. So I knew it was going to be small numbers. So of the 10 people, they came first to see me. It was over a period of 4 months-ish, roughly, because they came first to see me to learn how to to chart their cycle.
Mm-hmm.
Okay, that was a base. And then the next month they came in, we looked at that after they had their period, and we had a baseline cycle that we could
Mm-hmm.
start working from. And then at that time, I also gave them an Arvigo therapy session and taught them the self-care. So month one, roughly, when I say month one, I mean cycle, right?
Yeah.
Okay.
Yeah.
Cycle one was the baseline. Cycle two was to get the, to see what it looked like, what we were working with, and to receive a treatment and learn self-care. And then they would come back for 2, in some cases 3 more times after that with their charts, and they would receive another treatment, etc. at that time. And they were tracking their self-care as well.
Okay, so they had to agree to do their self-care on
Yes.
a daily basis, apart from when they were bleeding.
Right. So on the chart where they were charting their cycle, I had amended it with a little thing down there to say, are you doing your self-care?
Mm-hmm.
So a couple of interesting things came out of this. First off, they were, I didn't think that they were lying when they went the self-care, because they didn't just kind of like go
Mm-hmm.
on every single day. And there were cases where maybe they only did it half of the cycle,
Mm-hmm.
or in some cases only a third. But I would say that at the end of this, that this study can be done with a high degree of adherence to what we were asking them to do.
Yeah.
I'd say on average, throughout those people, they were doing it every other day. The self-care, which I think is really, if you think about it,
yeah,
that we all strive to be that good with our self-care, right?
Yeah. Yeah.
So I focused a lot on, I did see for those that had limited cervical mucus, meaning not a lot of highly fertility sensation, which is that feeling very slippery, and also didn't have it for a lot of days. We like to see at least 5 to 6 days of that sensation in the cycle. That's a good sign of reproductive health. The people that didn't have that, there was a significant improvement.
Amazing.
Okay. And the people that had short luteal phases, there was a significant improvement. I mean, if you have someone that had an okay luteal phase to begin with, you're not going to expect an improvement. If you see someone that has okay cervical fluid to begin with, you're not going to expect a huge improvement as well. So if I were to do this again, I would look at the cycle chart first and then decide whether they were a candidate for the study, for example. And that way,
I hope you get to do it again.
But what the real surprise was is that I learned to be open to outcome. Most of the people that came to see me, 8 out of the 10, had very painful periods.
Mm-hmm. And that's often why they end up with us anyway, isn't it? I mean, it's right. Not the people that come to us in the first place have generally got a reason for seeing us.
All right. And I was tracking how many days of pain are you having in your cycle. And a lot of it I knew because they were taking Advil or some other kind of medication or they were staying home. So I knew, even though I was asking, we were really focusing on cervical mucus and luteal phase. This was the most striking result from the studies. So I really learned to be open to outcome because in all cases, I'd say that was the most significant and most measurable improvement in my client, in the reproductive health of the people that participated.
So exciting, because I know this anecdotally, and when I first heard about this study that you'd done, it was just so wonderful to know, and it really made me realize why we take notes and why we keep records so that we can start to track this stuff.
Yeah, and also that I think another really important outcome of the study was how those that participated, they wrote testimonials as well. It wasn't so much about their reproductive health, it was how they felt about their reproductive health, how they felt more connected to their body, how they felt more knowledgeable about their body. And so many times we see clients, Hilary, right? And they come back the next month. How are you doing? Oh, the same. And then you look back at your notes and you say, okay, well, you talked about painful periods. How was it this cycle? Oh, actually, it was better.
Mm-hmm.
We talked about the leaking urine. How was that this cycle? Oh, yes, that's much better. Or your constipation or whatever. Mm-hmm. And so this, by getting them to track, they're more accountable and more participating in the therapy. You're
And
really
they
part
get to
of their
see
healing.
their own improvements. Yeah, fantastic.
And
So,
then the good thing is that they really see and appreciate and
yeah.
understand the value of the work that we're doing.
So the three kind of the biggest take homes you got from this study then were the lack of pain,
Mm-hmm.
improved luteal phase,
And improved cervical
and
length of, improved quality and quantity and duration of cervical mucus during the fertile phase.
which just makes us realize that we, I get so conflicted about this, because on the one hand, it's like, why do we need to prove ourselves in,
I know.
these parameters? But in the world that we live, people want proof. And also we're asking people to pay us for therapy. So they need to know where they're spending their money. So it is really worthwhile tracking the information. And who is better to do it than an astrophysicist who can actually do these charts and numbers? Because that certainly is not my my superpower. So as practitioners and for our clients, that's something really positive that we can share with them.
Mm-hmm. That's right. And with every client that comes in to see me now, well, not right now,
Yeah, not right now.
when however we're going to meet with them, we go through after the intake. We go through and we decide on 3 things that they're going to focus on, that they're going to track before they come to see me again, or 3 things that I'm going to send an email in 2 to 4 weeks and ask them how they're doing. And these are the 3 things that I'm checking in on.
Brilliant.
Not necessarily related to fertility,
No.
could be, digestion.
I mean, that's the thing though, isn't it?
That's how this has changed my practice, Hilary.
Yeah, because we remember, so, when we're in the midst of feeling sick, it's just like, it's like, I can't even remember feeling well. And, I've had a headache forever. And then as soon as my migraine's gone, I forget that I ever have them. So actually asking our clients to really become aware and to do some charting, and then it also encourages us all to keep on doing what we're doing. So tell me where it is that you work.
I reside in at my home studio, or at the
no in the clinic that you work from.
The clinic. It's Reply OBGYN, REPLY. I love it. Their thing is, you ask and we reply.
Very clever.
It's a very forward-thinking, fertility awareness-based OBGYN practice.
And they, how forward-thinking that they actually ask you to work there. And do they ask all their clients to see you, or how does that work?
There are 3 of us, fertility educators that are local, and then we have a couple more that are elsewhere in North America that can do telehealth. And so as part of their they call it subfertility treatment plan, it's a period of finding out the underlying cause of why they're unable to conceive, and then they do that with the aid of charting, because they do targeted hormone blood work and ultrasounds based on where you are in your cycle. And if you're not charting, you're not going to know where you are in your cycle, right? To come in. So, and then there's a period of fixing, if there's some things that need to be fixed, and then there's a period of timing intercourse and etc. It's about a 3 to 6, it's a minimum of 3 and up to 6 month time. So, and fertility education is an important part of that. So there are some methods that we teach to help you achieve pregnancy, and if you think about it, because those are the easier ones to learn, and because you're not, whereas those that are the ones that you're using to try to avoid pregnancy, really, there's a lot more information in that, and they're a little bit more difficult to learn because you're trying to avoid pregnancy.
Yeah, there's a little bit more at stake. What's the worst thing that can happen if you're trying to get pregnant is you get pregnant. Whereas, the opposite is not so good if you're trying to avoid.
So I teach both. Some patients are trying to conceive, some patients don't want to conceive, and they want a natural.
Yeah. And I have to say that in the years that I've done this work, I have worked with some you know, really talented, intelligent women who have got to the age of, you know, their late 30s, even into their 40s, without understanding what a fertile cycle is and when to have sex if you want to, because we're not taught this at school.
We're not. And Hilary, going through this training, I was in menopause.
Mm-hmm.
And I'm telling you, silver hair here, that there were things that I learned when I went
Yeah.
through the training that I didn't know.
Yeah.
Also, something very interesting that I, as part of going through the training that I've had, even though I'm not cycling, I do my body symptoms every day. I check cervical mucus and I check my basal body temperature. And I self-diagnosed a thyroid problem based
Mm-hmm.
on my basal body temperature, and it's been addressed. And if I hadn't been doing the basal body temperature measurements, I was just continually going downhill.
Well,
So
that
at
is our
all
next interview, my
phases,
friend.
see, there you go. That at all phases of life, it's
Yeah.
relevant.
Well, we have to be our own health detectives, and that's why I love what we do. We gift you, the client, the massage, your health in your hands. And that's one of the, I mean, I always say we give our clients a going home present. And, you know, that's what I love about the work that we do. So thank you so much, Donna, for taking the time to talk to us. And you are based in North Carolina.
Yes, Cary, North Carolina.
And I have been there, and it's a very nice place indeed. And she does a fine breakfast. So, you know, I will come past you again, although I'm never flying out of Atlanta Airport ever again in my whole life. That was terrifying. And I hope to see you somewhere in the world before too much longer. And as soon as this pandemic is over, we'll be right back out there getting our hands on clients again.
I hope so, Hilary.
Yeah,
I hope
indeed.
so. I hope so.
Okay, thank you very much, Donna, and I look forward to seeing you again. Take care. Goodbye.
Okay.